Welcome to Let's Thrive Postpartum.
Welcome to Let's Thrive Postpartum. I'm Kelly.
And I'm Ashley.
We are so excited you are joining us this week. We've got a great conversation coming up. Before we jump in, Ashley, I just want to check in on you. How has your week been going?
It has been great so far. We have a new addition to our family, not a human. We got a dog over the weekend. And thanks, a puppy, I guess I should say, to be specific. And yeah, it's been really exciting. The kids love her. And yeah, we're kind of back in the throes of figuring out, training and all that stuff.
So you're back to the days of kind of having an infant again, of being up all night and the potty breaks and all of that.
Yeah.
Or are you adjusting? How's the sleep going?
Well, I don't know if I've mentioned this before on the show, but sometimes my kids are not the best sleepers. So there's already been for a while now nights that we're very frequently up in the middle of the night anyways, which I think was part of the reason we were like, let's just go ahead and get a puppy now, because we are not getting consistent full night sleep and haven't for the past couple of years. So we'll just do it now, and then they can all grow up together and hopefully all learn to sleep together and be potty trained together. It'll be great.
I am so excited for you. And I know they are just loving every minute of having a new puppy.
Yeah, it's been a lot of fun so far. What about you? What's been going on?
It's been good here as well. I had family come down from out of state that I have not seen since before COVID.
Oh, wow.
It was absolutely wonderful to spend time with my cousin and my aunt. And she has 2 kids that I also have not met that are my daughter's age. And so it was just a blast to spend a couple days together, having cousin time, kid time. It makes me remember how great it is to have family in a village, and my family isn't always close by. And it was just, it was a great way to spend the weekend.
Yeah. Well,
also, thank you for my cousin for driving an insane amount of hours to come and see us. You're the best.
Oh, and I'm sure the kids had so much fun playing together and just seeing. It's always nice to see extended family members and older family members, and just, I don't know, it's great for kids.
It is. They've never met. So it was good to see a 4 and 2 2-year-olds all interact with each other.
How was it?
They had a blast. They all loved each other. I was a little worried about how she was going to interact with other kids all the time.
Yeah.
Oh my gosh, so in love with them. She still keeps talking about them. I mean, it was precious.
Oh, good. Oh, that's amazing. Well, Kelly, do you want to get us started? We've got to intro our 2 amazing guests that we have coming on the show today.
I'm really, really excited about this week's episode. And while it may sound kind of South Carolina local, this is one of those episodes that I think wherever you are, this has got some great information. So we are being joined this week with Dr. Constance Guille and Dr. Courtney King. They are with MUSC, and they're going to talk to us about reproductive psychiatry and all the new pharmaceutical developments that are happening for postpartum depression. So I'd love to introduce Dr. Guille first. Connie Guille is the director of Women's Reproductive Behavioral Health Division and professor in the Department of Psychiatry and Behavioral Sciences at MUSC. Dr. Guille completed her psychiatry residency training and specialty training in perinatal psychology at Yale University. She also established the Women's Reproductive Behavioral Health Division at MUSC.
And Dr. Courtney King is an assistant professor at MUSC, and she also works within the Women's Reproductive Behavioral Health Division in clinical research. She received her doctoral degree in neuroscience from MUSC and was working within the Charleston Alcohol Research Center. She's active in the community as a recovery advocate and co-leads a local nonprofit organization called Iron Wolf Recovery. These 2 amazing women know so much, have so much wonderful information to share, and we can't wait for you guys to hear.
Absolutely. So they're going to share a couple great insights. They're going to define what reproductive psychiatry is and how they are supporting pregnant and postpartum women. We're going to talk about new pharmaceutical developments that are treating postpartum depression, 2 unique programs in South Carolina that are serving moms statewide, and really advice for any mom listening who is looking for extra mental health support. You are really going to love this episode.
Welcome, Dr. King and Dr. Gill. Thank you so much for joining Kelly and I today. We are really, really excited to ask you guys some questions and get some really, really wonderful information that I think some of our listeners and moms out there are going to love. I think to start us off, if you guys wouldn't mind just introducing yourselves and telling us a little how you became interested in specializing in the maternal mental health field. And I guess MUSC has a women's reproductive behavioral health specialty division. And whoever wants to start off, feel free.
I might have a longer version because I'm about a decade older than Courtney. So, but I was super lucky. My first job out of college was at MGH in the Department of Psychiatry. And I first learned, from the Center of Women's Health. So I heard about this really early on in my career. And I went to med school thinking definitely mental health, definitely women's health. But I always sort of knew about this reproductive psychiatry work. So as I went through my clinical training, it was so obvious to me before why we needed this work, but then actually going through clinical training, seeing just firsthand sort of how we are leaving women in these situations that are really not appropriate and unfair. And what I mean by that is, coming into the emergency room and having a woman who's pregnant and psychotic, and really obviously in a tremendous amount of distress, but no one's going to use a medication because they're concerned about the medication's effect on the fetus when this woman is clearly decompensating and not doing well. Or just, so many examples of that along the way. And just even subtly, sending women home from the hospital when they have no supports whatsoever. They have like all of the stressors on top of them. They're managing so much, just so many reasons why that we need to figure out how to better take care of this population and support them. So I chose a residency place where I could get this training. There was like one of 3 in the country at the time, or 2. And so really fortunate to get that subspecialty training during my residency training. And then we ended up in Charleston, South Carolina, which was sort of we weren't planning to be here, but we are. And I'm so excited that we are, because when I got here, there was nobody here doing this work. And so it was just an amazing opportunity to bring what I had learned along the way. And I would say the Department of OBGYN at MUSC is so collaborative and sort of welcomed me in, and we just started this collaboration and have grown this division over the past decade plus.
Wow. That's amazing. Thank you so much for sharing that. So were you a part of the, I guess, spearheading how this developed at MUSC here in Charleston?
Yeah, I was the founder. Like, it was just me that started.
Yeah.
And then some very brave people that started to join me. So I think, early on when I first got here, I received a career development award that is actually called Building Interdisciplinary Research Careers in Women's Health. So it was like this perfect niche for me. And then that's what started my collaboration with OBGYN. I started 1 day a week of just clinical work in that office. And from there, and was doing research on my other days. And then from there was a couple of brave residents that came to work with me. And then we just started doing more of that and more training. Now we have about 15 residents a year. We have a reproductive psychiatry fellowship. We have a team of 30 doing clinical research and clinical care and education. And it just really came from, I think, a lot of people that have the same experience of like, when you see what's happening in this area, it's almost like, how could you not want to jump into this work? And so I feel like that's sort of who our team is. And so it just keeps kind of growing from there.
How long ago did you start this division? How old is it?
Let's see. So I think like officially started I always have to remember in terms of where my kids were and like where I had my children, like helps me remember the year. So it was 2012 when I got that award and started working in this area.
So if the program is about 12 years old, Dr. King, when did you join?
So, that's a good question. I think I joined in 2019. Does that sound right? Yeah. So I found a much more roundabout way into this whole field. So by trade, I am an addiction neuroscientist, and I did my graduate degree at MUSC in the Department of Psychiatry. I was an alcohol researcher. So I was studying, like the mechanisms of relapse and how stress relates to that. But my work was always based in sex differences. And I was very interested in how diseases progressed in differently for males and females. And I kind of, built a translational career around that. By the time I was graduating, I was ready to move away from like bench and animal science and into the clinic. I was always much more interested in what was going on clinically and in the community. And I just kind of happened to find Connie, and stepped into the opportunity to find that it was a field that I actually really, really loved. A lot of the stuff that I do just kind of happens by chance and it ends up working out. I just follow that string. And so I had always really specialized, like I said, in addiction and substance use disorders, and being able to look at that population is something that I have been extremely excited to do because there's so little support, so much stigma specifically for mothers that are struggling with substance use of any type. So to be able to put forth programs and work in that world has been a dream come true. I absolutely love trying to find ways to help support families with Mom First.
I love that you have taken your interest and expertise in the addiction and brought that over to maternal mental health.
Mm-hmm.
The two of you are doing along with the whole team at the Reproductive Behavioral Health Division is so impactful. As you mentioned, Dr. Guille, there wasn't this years ago. I mean, it's brand new and there are so many moms. I was one of those who struggled and didn't know where to get help. Kind of having those resources and having you both do what you're doing is making such an impact. Can you tell us a little bit about what your team is doing at MUSC, what you are seeing as far as maternal mental health for all the moms that are struggling out there?
Yeah, I think what really guides us is clinical care. So as we're seeing patients, we are identifying where the major gaps are. And, oftentimes we're seeing people for the first time that probably needed to see us 4 months ago or 5 months ago. And we're recognizing, gosh, there were so many missed opportunities to try to identify people earlier and get them care. So a lot of our work is actually just been focused on how do you do that? How do you do a better job letting moms know that their support's available to them? How do you actually do a better job screening, which we know we should be doing in practice? And really, so listening to our patients, but then also doing qualitative research to systematically listen to our patients and providers and use all of that to inform the development of interventions. And our interventions always involve some level of tech. It's nothing complicated, but it's just such an amazing way to reach this population. And so we're doing work right now just testing, which is a really simple text message-based screening system, connects with a phone and a care coordinator who can really just help meet women where they are and figure out what their needs are and help them kind of put a plan into place and get the supports they need to put that into place. So making sure people can get to treatment. And then our Mom's Impact program, which is really just, you don't have to be enrolled in this system to be able to reach out to that care coordinator to get access to care.
Can you tell us a little bit about the Mom's Impact program and what population it serves, location-wise, and how moms out there can learn more about it?
Sure. So Mom's Impact is a statewide perinatal psychiatry access program, and it has two components to it. One is patient-facing. So if you're a pregnant or postpartum person, so within that year after delivery, and having any sort of mental health concerns or substance use or any kind of just major stressors that are occurring during this time, you can literally pick up the phone and call this number. You'll Monday through Friday be able to connect with a care coordinator who has at least a master's in clinical social work, so has that really good mental health background. They'll do sort of a brief assessment, figure out what's going on, and then connect that person to what makes the most sense for them for next steps. And that could be therapy, and medication. It could be finding sort of more moms in the community, more peer support. We also know that, there's a lot of barriers that get in the way of people reaching out for care. And so really trying to address those as well.
Yeah. I've referred a couple of my own clients to you guys. Just they didn't know that this was an option, that the care is actually pretty accessible, especially in terms of seeking out psychiatric support. And it's been amazing. And it's something I wish that every state, had a version of, but I think that South Carolina is really lucky that it's here. And it's just about making sure that as many people know about it as possible.
Well, it's actually a little bit different in South Carolina. So nationally, this program was actually modeled off of a perinatal psychiatry access program. But those programs are a little bit different. They're just provider facing. So If you are a healthcare provider, you can call this number and sort of get support to take care of your patient. But we know in our state that like half of our counties don't have OBGYN providers. So we could train all the providers that we have, but that's not going to actually meet the need. So we really had to make sure that there was both, that there was patient-facing access, but then we're also training and supporting the providers to do a better job and just being supported to do this work.
Yeah.
And we will, for all the moms listening, put the phone number that Dr. Guille is mentioning in the show notes. So if you're interested, if you need help, this is a great resource for you. Please check that information out.
Yeah. Can you guys touch a little bit on like what is going on in the world of maternal mental health? What are new treatment options or things that have been happening recently? What do you guys know?
I'd say one thing that's very relatively recently new is that the stigma in this area, although it's still very present and it's still very palpable, it is a lot different than where we were 10 years ago. People talk about these much more, and that's really a wonderful thing. We need to keep sort of moving in that vein. There's been amazing treatment development in this area, as you guys have probably heard of brexanolone and zuranolone. So we were part of both of those clinical trials to bring those medications, hopefully, to get to market, which they are now. Brexanolone, it was this 60-hour IV infusion for treating a postpartum depression. And amazing results. We see people getting better in 2.5 days, but also not the most accessible medication. If you're sitting there getting a 60-hour IV infusion, you have to be in a healthcare center. So what's really cool is now that medication has an oral preparation, the zuranolone. And again, so women can take this medication in the comfort of their own home. And again, it's a short-term therapy, about 14 days, and people are getting better in like 2.5, 3 days, which is just incredible. In this area, we're always saying to people, we started an SSRI. Well, we've got like about 6 weeks till we see the full benefit of this, which is a really long time when you needed to see me 4 months ago, right? So I would say that like those are really exciting options that are available now.
Is that something, do you guys feel like a lot of OBGYNs and pediatricians are kind of generally aware of? I know that when we talk to a lot of moms, the main points of contact that they have after giving birth is the pediatrician and their OBGYN. Those are typically the first people that they're seeing and kind of healthcare providers that they're talking to in some sense. And so like Kelly and I, as we're talking with moms, are always also considering where are the gaps and the people that moms are actually talking to. And where do you guys see, I guess, how to keep closing those gaps in terms of helping moms be aware of how do they advocate if they think that this is something that could be helpful for them, but they don't have a psychiatrist or they haven't gone to see their GP in a while? What do you think?
Yeah, I think there's a few things in there, but one, I would say if a mom is struggling, reach out to a trusted friend, your partner, just to get the conversation started, because the next step is sort of navigating a very complex health system. And so just enlisting someone else's help in that who maybe can just support you in doing that, I think is really good. Our pediatricians are doing a much better job screening. I mean, it's so impressive. The mom is not their patient, you have to remember, and they're willing to screen and refer. And so just continuing to support them to do that, I think is really important. Our OBGYNs are jumping in to do the work and to try to screen and to try to help, but they need much more support in doing this. They don't have a mental health background, and so they are doing the best they can. I wouldn't feel comfortable as an OBGYN jumping to zuranolone. I've never prescribed this before. And there's some challenges right now that we're facing, which is basically insurance coverage. There's a lot of prior authorization that has to happen before we can get that done. Some hoops to jump through to get that medication to happen. So we're not quite there yet in prescribing that really regularly.
So it sounds like too, I guess one of the biggest take homes for moms is to think about as you're talking with people, if you're talking with a provider, and if you feel like something you're not feeling like yourself, is to ask for those providers to help connect you with who you need to be talking to get the best support.
Yeah. And I also, a lot of this is insurance based. On the back of your insurance card is a mental health, behavioral health number. You can call them and also get a list of who's in your network, who's available to me to see. And then you can actually cross-reference that with Postpartum Support International. There's a just a provider, find a provider, put in your zip code and look to see like who in your area has some specialization in perinatal mental health. Maybe are they on your insurance, and sort of go from there. But those are two good places to start.
Yeah. Mm-hmm. I would also suggest, I know sometimes individuals will feel uncomfortable talking to their provider about some of these things, or maybe they wanted to bring it up to their family and it just wasn't a topic that their family talks about. So if you're, something's not right, something's not feeling good, keep trying different avenues. Like there are resources like Postpartum Support International, like Dr. Gill said, talk to different friends about it, look for programs like a Mom's Impact where you can get in contact with somebody. Just because somebody may not have initially acknowledged, or maybe you didn't feel like you did a great job of expressing what was going on, does not mean that, it should be kind of pushed aside and, oh, we'll deal with this later. Like just, if something's wrong, keep going for it.
Something we've heard a couple of the moms that we've interviewed with say they had to bring it up to multiple people before somebody really took them seriously, which makes my heart hurt for them that they had to go through that vulnerability a few times to say, I need help. Dr. King, I'd love to ask you about what you're seeing or any advice for moms who may also have substance issues. What are you seeing and what recommendations do you have if a mom is struggling in that way as well?
Sure. Yeah. So I can answer that question from the perspective of like a community health worker, somebody who's working in the community. I'm not a clinician, but we're definitely seeing a rise in substance use disorders, particularly opioid use disorder, similar to what we see in the general population. It's mirrored in pregnancy and postpartum. And, substance use and overdose deaths are actually one of the leading causes of pregnancy-related deaths. So it is something that's happening and it's very serious. We also see alcohol. That's a big culture, mommy culture, that I think gets underneath people or gets ahead of people. And sometimes they just don't know where to go. And it's carries so much stigma that a lot of people will just kind of keep it inside. We know that sometimes the mutual aid groups, 12-step or AA, aren't super supportive of moms in general. That's not true of all of them. There are definitely incredible groups out there, but as a whole, there can be instances where there's a lot of stigma towards mothers. And I would suggest, that's one of those places where it's really hard to come up against that vulnerability over and over again and tell people, I am struggling with this. But it is the sooner that you can get on top of it, the sooner that you can get somebody in your corner and somebody walking with you, the faster that you are going to start to feel more stable and in control. These are not disorders that just kind of go away on their own, right? These are things that really need support. And there are absolutely programs out there that reach their hand out and can walk with you. There are a lot of moms who are in recovery and becoming more loud about it, recovering louder, talking about how they're getting their family reunified or showing up for their family. So the more people who can step into that and talk about it bravely, I think the better it will be for moms who are struggling.
Yeah.
Dr. King is super humble, but I want her to talk about her program that she's actually developed. I mean, she's literally like leading the way in an area that I think is really speaking to and reaching moms that are struggling with substance use disorders. Do you want to talk about that?
Please do. Yes.
Sure. I'm happy to. Yeah. So about 2 years ago, we started, because of what I was just talking about, there is a lot of stigma specifically for mothers in substance use disorder recovery or still in active addiction. I had done a lot of qualitative research around, like if you're coming into recovery, what do you feel like you're missing? What are you needing? And over and over and over again, I just heard, I want other moms in recovery. I don't know where to find them. Like a peer is not quite there. I need somebody who understands what I'm walking through. So in response to that, I started working with a really wonderful nonprofit called Birth Matters in Spartanburg. They train community-based doulas. And a community-based doula is a full spectrum doula. So they support pregnancy. They can be at the birth and then up to a year postpartum. And they specifically serve the community that they're from. So I was like, wow, this is like a really good opportunity to bring peer support specialists or people who are already working as mentors or supporters in the substance use world to then get some prenatal education and birth support and postpartum lactation support, that whole full spectrum, and dual train them. So we are working on training, hopefully 36 in the next 3 years, peer recovery doulas. So these are specifically mothers in recovery who have been trained as peer support specialists and community-based doulas who can provide that really, really intense layer of support for individuals for almost 2 years.
That's amazing. Are you in the training process? Where are you as kind of getting this launched?
Yeah. So we have done 2 cohorts, and we have another cohort starting in the fall. So we'll do 2 every year, and we're moving around the state so that we can start building up this workforce in different areas in the state. We have 5 who are fully trained and working in the field in various areas. One of them is actually on our staff. She supports the Myrtle Beach area of South Carolina. And then a couple of others are working in areas like in treatment, in detention centers, places where sometimes perinatal substance use disorder is showing up. We have 3 that were trained in the spring, and they're about to go into mentorship. So another piece of this is they get a peer recovery doula mentor for almost a year as they walk into the field and kind of start to figure things out. So yeah, then we'll keep moving forward.
That's amazing. I know. I love there's so much to be said for like the peer support model for all kinds of conditions and different populations. That's really exciting. Yeah. Oh my gosh. I can't wait to read and hear more about that over the coming years.
I do want to ask a question that's a little off topic, but goes along with this in the peer support. So as you both know, one of the things that Ashley and I are trying to do with the podcast and kind of launching Thrive Postpartum is that peer support to give people who have virtual access to group support, education, but also fellow moms who are just going through something similar, whether it's standalone or in addition to therapy and medication. What have you both seen as far as does peer support help moms in this postpartum period? And have you seen anything that works well?
Yeah, I mean, I can start. Yeah. So, I mean, I think just the act of having somebody who knows where you've been, that's like a term that we hear a lot from individuals who are the supporters and also receiving support, is just having somebody who knows where I've been is like opens doors, right? It brings people, it makes them feel more comfortable. It allows them to talk more freely, to have somebody who can help navigate these complex systems and tell them what worked. It offers hope when you're feeling really, really low. You know, I'm a little biased here. This is like the area that I like to work in, but I do think that adding peer support into a care regimen, whatever, even if it's before somebody's gotten into care or maybe they've started to transition out of more intensive care, is never going to be hurtful. It's almost always going to add a layer of resiliency for the person who is stepping into treatment, into recovery, whatever they're dealing with.
Yeah, I would agree with that 110%. And I think what is really important, though, is that we're supporting this workforce. I mean, it is not easy to be in this role, and it's really important for people to understand the role. You're not there to solve somebody's problems. You're not there as you can call me any day or time. You know, we see a lot of peers that are really good and have really good intentions and get into trouble. And so just because they're taking on too much and they're not just speaking from their experience. And so really, there's a really important component of this, of supporting peers doing this work. And I think that can't be overstated because we actually don't have a system to support them right now too, which makes it even more complicated. But that is, I agree. Otherwise, it could be incredibly helpful.
Yeah, that's such an important point. And that's one of the things that I'm really going to try to focus on over the next couple of years is helping build support barriers for our supporters.
Yeah. I think I probably should have asked this question back at the very beginning, but kind of help define a little bit how like reproductive psychiatry differs and is similar than any other type of psychiatry. Like what are some of the key points about, you know, if a mom is like, oh, you know, why it might be helpful for them to seek out somebody that has this specialty?
Yeah. So a reproductive psychiatrist, the foundation is psychiatry. So we're all, I mean, you have to have that foundation to then do reproductive psychiatry. This reproductive psychiatry is just this added twist of now we need to consider the fact that this person is pregnant. We need to consider, you know, mom's health, fetal health, baby's health, newborn health, and child health and family health. And so what makes us a little bit different is that in psychiatry, we have a lot of randomized controlled trials. We've done all of these testing of all these different interventions. And so we have this great evidence base, right? But we've also, in parallel to this, been excluding pregnant and postpartum women from studies forever, right? We actually excluded women of reproductive age for a very long time. And so in this area, now we have to basically deal with this limitation of data and how we can actually use that to help people make informed decisions. So we've got increasingly better and better data to guide us, but it still is going to have limitations. And I think working with someone who can really communicate, like, here's, you're deciding to take this medication or you're deciding to not take a medication. Here's what I can tell you about the risks of this medication or not taking this medication. Here's what I can tell you about the risks of untreated illness, so that people can actually really make informed treatment choices during this time. And it's not as easy as when you don't have those nice randomized control trials that we always draw from in medicine.
Makes a lot of sense. It's almost too just being able to talk with someone that you guys do have more of you kind of have to have a more wraparound perspective, like you said, because there's, the mother, the fetus, if she's pregnant or after giving birth, like just taking in all of those different factors into account, that is different than it is for other patients.
Exactly.
Yeah.
Dr. Guille, Dr. King, what advice do you have for moms who are listening right now? They might be in South Carolina and they might be in another part of the country, but if they're listening and struggling right now, since you work with both moms and the provider side, what would you recommend for them to do?
So, I think first of all, people should just know right off the bat, like, you are not alone if you are experiencing these conditions. 1 in 5 women will experience these conditions during pregnancy and postpartum. And so if you're experiencing that, there's a lot of other people around you that have experienced it too. And just start reaching out to who you feel most comfortable talking with about this. Also know that, there are really good treatments available. And it doesn't have to be medication. There's really great therapies, and there's people that can help you find those things that are going to be good for you and that it will get better. And when you are better, please share your story, because that is what destigmatizes this area more than anything else. So just keep talking to people that will be listening to what you have to say.
Dr. King, what about you?
I would agree with that. I was going to touch on share your story. You don't have to do it in a way that, is on a billboard. It could just be talking with another mom that you're friends with. But I think the more that we kind of demystify pregnancy and postpartum and kind of rip off the Band-Aid of, this is the most beautiful and that's the only potential way it can be, the more people will find the support that they need, even if it's, not even at a clinical level, just being able to see one another and have more open conversations and feel supported in their homes and in their friend groups.
Yeah.
Thank you both for coming on and helping us share this story and to talk about some of the resources, things moms should know. Ashley and I both just kind of believe the more, like you said, the more we talk about it, the more moms aren't going to feel alone and feel more empowered to share their own stories or to raise their hand and say, I need help. So thank you both for what you are doing in general for our community. It makes such a difference, but also just for coming on and talking with us today.
Well, Thank you so much for having us. And thank you so much for doing this. I think that these podcasts are really impactful. And I'm just so appreciative of you guys taking the time to talk with us and to share this.
Yeah, I'm so excited to know that this exists. I think a few years ago, Connie and I talked about we should start a podcast where we tell people's stories.
Yes.
And we never did it. So we're so glad that it exists.
Well, we recommend it if you ever want to. It really is so much fun because we get to meet such amazing moms who have been through it, who want to share their stories, people like both of you who are helping and bridging that gap. So we highly recommend a podcast, and you're welcome back anytime.
Oh, thank you.
Thank you.
Thank you both for coming today. And for all of our listeners, I think there were some amazing takeaways that were just shared. Really comes down to advocating for yourself, talking to someone that you trust that can kind of guide you along this way and be that extra sounding board, and know that this is going to get better. There are lots of organizations out there that can point you in the right direction, refer you to someone, or get you treatment. There's really no need to suffer in silence. The more we can share and talk, the better. And again, you're not alone in this. Ashley, thank you for today.
Yeah. Thank you, Kelly. Always a pleasure.
We'll see you next episode.
If you enjoyed this episode and found it helpful, please be sure to hit subscribe, leave us your feedback, and give us a 5-star review. For even more support, visit us at wethrivepostpartum.com/podcast to sign up for our newsletter and learn more about our community. Remember, you are not alone. With support, you can feel better. Together, let's thrive postpartum.